Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Is diabetes remission a real thing? And does achieving diabetes remission mean following some weird diet or relying on extraordinary superhuman self-control and denial? Listen in as we explore these questions and more.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jeddah.
Hello, it's Dr. Jeddah here, and thanks for joining me for episode 24 of Type 2 Diabetes Talk. Let me propose a question, which happens to be this week's topic sent in by Helen. Helen asked, can type 2 diabetes go into remission? I hear a lot about this phenomenon, especially from weird dietary proponents. Is it a thing? Should we be working towards something that looks like this? It seems extraordinarily reliant on superhuman self-control and denial. Thanks so much for sending in this topic, Helen. Diabetes remission is really such a great topic for us to cover, and Helen also raises some interesting observations about whether remission is actually a thing, about the weird dietary proponents out there on the Wild West web that sell you this phenomenon in various shapes and forms, about whether remission is a goal that's achievable and whether remission does take superhuman self-control and denial. All such interesting things to explore, wouldn't you agree? And we're going to dive right into this all today. Firstly, let's look at whether diabetes remission is actually a thing. The answer is yes, diabetes remission is a real thing. But personally, I don't particularly like the term for many reasons. And due to a lot of the hype around the term as well, which, like Helen pointed out, many weird dietary proponents out there on the Wild West web jump on and begin trying to sell you remission as a magical solution. As we talk about this topic today, you'll hear me talk about the various reasons why I don't like the term as well. When I started diving into the world of diabetes nutrition more than a decade ago, the general consensus was that diabetes was a progressive disease where you were destined to become progressively worse, go on insulin, and then die from the disease. Unfortunately, we still see this kind of attitude now, as Dean shared in episode 15, in the episode about diabetes unscripted. This is exactly what Dean's doctor said to him when he got diagnosed, which is something no one should ever tell you. It's just not something you want to hear when you've just been diagnosed, that's for sure. We also still, unfortunately, see this type of statement not only among health professionals, but in the medical care guidelines for diabetes. Even in 2024, it is a deeply ingrained attitude. Even though there were reported cases of diabetes remission back in the 1960s, the concept clearly never got on the radar because back over a decade ago, diabetes remission wasn't part of any conversation. It simply wasn't acknowledged as a possibility. The first report on the concept of diabetes remission was published in Diabetes Care in 2009. One of the reasons diabetes remission first came on the radar was because scientific publications started using the terms remission and cure as possible outcomes of diabetes interventions. But back then, the interventions being referred to were largely surgical. For example, bariatric surgery, which is weight loss surgery. The fact that diet could achieve remission wasn't really anywhere at that stage. We just didn't see diet and diabetes remission being connected at all. In 2017, the DIRECT study found that diet alone in the context of an intensive weight loss program led to diabetes remission. So suddenly, following that trial, diabetes remission was a concept that started to become part of various conversations. More broadly, people started to consider that diabetes perhaps was not a disease destined to become worse and worse over time, but could be halted in its tracks. It wasn't until 2021, though, that all the diabetes organisations across the globe published position statements acknowledging diabetes remission as a thing. 2021, that's not so long ago. And this time, the position statements were not just putting it down to surgical means, but to changes in nutrition and weight management as well. And when the consensus committee met to decide on the terms and definitions, various terms were covered. For example, diabetes resolution, diabetes reversal, diabetes remission, and diabetes cure. And remission was chosen as the preferred term because it describes that diabetes may not always be active and progressive, but it also suggests that the improvement may not be permanent, that there could be relapse. The best comparison of the term remission, of course, that we know well of is for cancer remission, where remission is used to describe a disappearance of symptoms. But we also know with cancer there is a potential for relapse. And that's what the definition of diabetes remission relates to. So let's talk about that next, the definition of diabetes remission. So diabetes remission is defined as an HbA1c of less than 6.5%, taking no glucose-lowering medication for at least 3 months. HbA1c is a blood test ordered by your doctor and conducted at a pathology lab. A diabetes diagnosis is made when a person has a HbA1c of 6.5% or more, which is why the criteria for remission was set at an HbA1c of less than 6.5%. In terms of meds, you need the 3 months of no medications to allow any waning effects of the drugs to dissipate, and only then can your doctor assess your HbA1c values to determine remission. And if you maintain the HbA1c of less than 6.5% without glucose-lowering medication for 3 months or more, then you are technically in diabetes remission. And this includes all types of diabetes drugs, even metformin and Ozempic and Wegovy, which may be prescribed for weight loss, but they are still a glucose-lowering drug. Obviously, if you continue medication, it's not possible to see whether a drug-independent remission has occurred. So again, diabetes remission is defined as an HbA1c of less than 6.5% taking no glucose-lowering medication for at least 3 months. So now you might be wondering, okay, diabetes remission is a real thing. How can you achieve diabetes remission? And primarily, there are 2 ways. The first way to achieve diabetes remission is through surgery, such as bariatric surgery. For some people, surgery may be an appropriate procedure. That's something you certainly need to explore thoroughly with your doctor. But overall, surgery should really be a last resort because weight loss surgery also comes with a whole new range of things to deal with, such as possible complications, lifelong supplementation, and long-term nutritional deficiencies can also occur. So like I said, weight loss surgery isn't going to be for everyone. So the second way to achieve diabetes remission is through making changes to your diet and nutrition. The 2 diets shown to increase your chances of remission are very low-calorie diets and low-carbohydrate diets. So very low-calorie diets restrict calories to a very low 600 to 800 calories per day. And these types of diets need to be conducted under strict medical supervision because they are very low calorie. And obviously, one of the biggest downfalls, as Helen pointed out at the beginning, is diets like these do require extraordinary superhuman self-control and denial. It is extremely difficult to eat only 600 to 800 calories a day. There's also been debate about the safety of these diets and their potential to cause harm to the body. For example, by restricting calories the body needs for basal metabolic functions, there could be potential for negative effects on body composition and physiology. And most importantly, very low-calorie diets just can't be sustained long-term. They are really only designed as a short-term intervention. And yes, they certainly can be very effective. We've seen this in research and practice. But when it comes to reality, if something can't be sustained long-term, then we have to question how effective that strategy really is, because unfortunately, the results you achieve probably won't be sustainable. The second type of diet to follow to achieve remission is a low carbohydrate diet. Now, I just want to be clear here on the definitions for low carb, because both keto diets and low carb diets are put under one umbrella and termed low carb, but they are different. Keto restricts carbohydrates to less than 10% of total calories, or generally under 50 grams of carbs per day. Low carb diets have a more generous and realistic amount of carbs in a range of 10 to 26% of total calories, or generally 50 to 129 grams of carbohydrates per day. Both keto diets and low carb diets are effective for achieving remission, but overall, the evidence shows that keto diets are not sustainable long-term, which makes sense because many people find them way too restrictive in real everyday life. And being reliant on superhuman self-control and denial, it's not a good strategy and doesn't improve your quality of life either. So they're major concerns to consider. Whereas in contrast, a low-carb diet is really a very flexible way of eating that is sustainable over the long term too. A low-carb eating plan does not require starvation or deprivation, with allowance for a wide variety of foods and meals to enjoy. And you can still feel like a real human in any situation, and that's really important. And a low-carb diet is what we've been encouraging at DMP for the past decade, and it has certainly helped thousands of our members and subscribers completely change their health and achieve remission too. Here's what Carol said. I can wholeheartedly recommend the low-carb diet for remission of diabetes. My partner has been following your advice since early in 2018 and is now 3 years in remission, has lost 65 pounds, which is 29 kilos, and enjoys a wonderfully satisfying diet. His HbA1c was 4.9 at his last blood work. His HDL, LDL and triglycerides are all now within range, and total cholesterol figure almost in range. This way of eating is completely sustainable, and we are so pleased we discovered your very helpful site. Thank you. Thank you, Carol, and thank you to your husband for following the advice that we provide and for achieving such great results. So as we can see, a low-carb diet is very effective and does help you achieve remission.
Are you ready to take charge of your diabetes health? Dr. Jetta's T2 diet program has been clinically proven in a randomized controlled trial to dramatically reduce A1C, weight, and medications in just 16 weeks. The T2 diet program will guide you step by step to discover an eating plan that feels natural and sustainable for you, and most importantly, works to get results. Learn more and join the program today at type2diabetestalk.com/programs.
Another question you might be wondering about then is how long can diabetes remission take to achieve? When you have bariatric surgery, the clinical effects and the observations of diabetes remission can present themselves very fast. But in the context of diet and lifestyle change, the clinical effects and observation of diabetes remission, well, that can be a bit slower, sometimes a lot slower. So let me just say, it's not a race to diabetes remission. And if you get involved in a race, you'll probably end up in a crash. When you want to change your HbA1c, you need to allow at least 3 to 4 months to see a substantial change. And in that time, you certainly can achieve a very large A1C reduction. For example, in the T2 diet study randomized control trial, the average reduction we saw was almost 1%. in A1C, and some people lowered A1C by 3%, and that was just in 16 weeks, so 4 months. And an A1C reduction of 3% is a large reduction that would require multiple glucose-lowering medications to be taken in order to achieve that same outcome. But proper nutrition can easily help you achieve this. This is a well-known and scientifically proven fact. Of course, let's put this into perspective. You're only going to see that type of A1C reduction if your levels are up at 9 or 10%. But let me tell you, it is more than achievable. And with proper nutrition, you can see reductions in meds too, as we saw in the T2 Diet Study randomised control trial as well. 87% of people taking the T2 Diet program reduced or stopped meds in 16 weeks. But like I said, when you want to change HbA1c, you need to allow at least 3 to 4 months to see a substantial change. Then, in order to establish remission, you'd need to have stopped all medications for at least 3 months for an official diagnosis of remission to be made by your doctor. But as I said earlier, diabetes remission isn't a race. And for many people, it can take longer, a year or more. And for others, the remission might not happen at all. So that leads us into another important consideration. What are your chances of achieving remission? So what the evidence from randomised and non-randomised trials shows us is that diabetes remission is achievable in around up to 50% of people. It's difficult to make any conclusions about the exact rates of achieving remission. It is very difficult to compare results of studies because there are so many differences between them. It's difficult to make a solid conclusion because many studies haven't measured remission. For example, 87% of people in the T2 Diet Study randomised control trial either reduced or stopped medications, but we didn't measure diabetes remission specifically. Many diet and lifestyle studies don't, so that is certainly an obstacle in the scientific evidence as well. What we are seeing, though, is that many people can achieve remission. So let's just say that it is certainly a possibility for you too. And as I said, one of the best ways to do it is through adopting a healthy, balanced, low-carbohydrate nutrition approach. At DMP, we've been educating people about a lower-carb way of eating for the past decade, even when it was a highly controversial topic. And look, we're proud to say many of our members and subscribers have achieved complete remission. A number of them have sustained their remission long-term or are headed toward prolonged remission, as I shared with Carol's statement earlier about her husband being in remission for 3 years when she shared that with us. Let me share a couple more testimonials from members who've either achieved remission or have come very close to it. Dusty said, "When I started DMP, I was 310 pounds, that's 140 kilos, and my A1C was 10. I had a very unhealthy lifestyle. Since then, I have lost weight. I am at 190 pounds, that's 86 kilos, and my A1C is between 6.5 to 7, and I no longer have to take medicine." Bill said, "DMP, in my opinion, is the best diabetes website worldwide. Many thanks for the top-notch info. With the info from DMP, blood glucose is strictly controlled between 4 and 7 or 72 to 126, and I'm off metformin for the past month." And let me just say, this isn't just applicable to those with type 2 diabetes. If you have pre-diabetes, your goal should absolutely be remission, getting your A1C back to normal on no medications, and that's possible. Here's what Cheryl had to say. "I have struggled a lot with these supposed healthy diet recommendations, and over the years I have been on every diet known to man. One day my doctor told me that I was pre-diabetic. My A1C was 6.1. All he told me was to cut back on sugar and take 1,000 units of metformin once a day. Then he sent me home and that was it. I kept questioning, how do I actually eat? That is when I found DMP. After only 1 year, all of my numbers are way down. My A1C is within normal range, 5.6. Cholesterol, triglycerides, and blood pressure are all normal. They were on the high side before, and I lost weight, 21 pounds or 9.5 kilos, something I have been trying to do for years and never could. Fast forward another 6 months and Cheryl shared, last week I went in for my yearly physical and my A1C was 5.5. The doctor had told me that if I could keep my A1C under 5.7 for a year, he would take me off metformin. So, I'm off metformin, and you could say that I'm not pre-diabetic anymore. So Cheryl had achieved what we might term pre-diabetes remission. And as I said, getting your A1C back to normal on no medications is really the ideal goal when it comes to pre-diabetes. In terms of diabetes treatment, what you eat is absolutely essential. As I've shared before and no doubt will share many, many times again, diet and nutrition are your primary number one treatment strategy. We know diet and nutrition is as effective, if not more effective, than medication. Helen also asked, should we be working towards something that looks like remission? My answer to this is yes, but it shouldn't be a race to remission. Of course, at DMP, we encourage people to work toward a normal blood sugar and A1C level. We've covered blood sugar goals in episode 11. At DMP, we encourage you to work with your doctor to reduce and stop medications. You only have to listen to the Diabetes Medication Series episodes 15 to 18 to know that deprescribing medications is something that should be on your agenda because it is more than possible. At DMP, we encourage diet and nutrition as your primary treatment strategy because research and experience proves the incredible results and benefits that diet and nutrition provide to you, including achieving remission. We encourage you to have a goal of diabetes remission, or in other words, achieving and maintaining a normal A1C level and working toward no medication. Of course, that's the ideal goal, and it is possible. But one of the reasons I don't like using the term remission as a measure of encouragement or even as your primary goal is because maybe you don't quite get there. What if you don't quite meet the criteria? What if it takes you several attempts? What if you fail to achieve remission? Will this leave you feeling deflated, bring up negative feelings for you, lead to depression? Essentially, we're really just talking about the benefits of having an A1C in the normal range. And from my perspective and experience and an abundance of scientific evidence, this is clearly the ideal goal. But achieving better health is a journey, often encompassing complexities, challenges, and even setbacks. What I propose to you is please don't race to remission. Do it gently over time. Don't put insurmountable expectations on yourself. Just take a proactive, step-by-step and sustainable approach and look at every step in your journey as a win. For example, any amount of weight loss is a win. Any A1C reduction is important. Any reduction in medications is incredible, and any improvements in your health are amazing. It all adds up a lot over time. And yes, remission may be possible. We've certainly seen it happen many times. Even if you never meet the criteria for a diabetes remission diagnosis, any reduction in A1C weight or medications is still incredibly beneficial to you in the long term. It's all noteworthy. As I said, remission is possible. We've supported many people to achieve remission over time, but please don't discount any improvements you make along the way as being meaningful and important improvements as well. You may come very close to remission, but given the defined criteria, you might not be diagnosed as being in remission. And that's not necessarily a disappointing thing. Take one of our members, Cheryl, as an example. Cheryl said, I happened on the Diabetes Meal Plans website when I was browsing the internet for something that I could try, something that would make sense. Once I became a member, I immersed myself in the information. I learned that my present diet wasn't working because I was trying to prevent diabetes, not treat the disease I already had. My weight dropped 6 pounds or 2.7 kilos and my A1C dropped to 5.8. This was an all-time low for me. Best of all, my doctor reduced my daily amounts of metformin and glipizide by half. Fast forward 4 years and Cheryl said, I continue to do well. At 70 years old, my HbA1c continues to be under control, my cholesterol continues to be controlled, and I maintain lower medication. So as I said, just because you might not get to that defined criteria of remission doesn't mean that all of those things that you do achieve, all of those improvements aren't noteworthy. Moving on, there are factors that can increase your chances of remission. So let's go over these. Firstly, the earlier in your diabetes diagnosis that you get proactive, the higher your chances of achieving remission. If you're newly diagnosed diabetes or have pre-diabetes, you really need to get proactive today. Don't wait days, months, or even years to get proactive, really. Don't fleet around the Wild West web. Don't follow shiny objects or the next best diet fads. Get the right guidance and support. Do it now and do it right the first time around. So I'd highly recommend you head down to our website to explore our programs and services. Another key factor that can influence remission is losing weight, around 20 to 35 pounds or 10 to 15 kilos if you have that capacity, because this can significantly stall the progression of diabetes. But again, you need to follow a great nutrition plan that helps you not only lose the weight, but you also need to maintain the weight loss too. That is key. Another factor that I've already mentioned is having the right guidance and support. That is absolutely essential. Don't fleet around the Wild West web, as I said. Don't follow shiny objects or that next best diet fad or whatever. So again, I'd highly recommend you head down to our website to explore our programs and services, because you really need to have proven, proper guidance and support. And as I already indicated, achieving and maintaining a lower A1C and decreasing meds, yes, these are key goals for achieving remission, but more importantly, these factors are associated with fewer diabetes-related illnesses over the long term. So that's really important. Our body is designed to have blood sugar in a healthy range, and achieving and maintaining that protects your health at every single level. And another thing, please don't get sold on a race to remission or buy into weird or crazy dietary proponents, as Helen brought up earlier in today's chat. Importantly, the key to any permanent change is sustainability. You need the right advice and an eating plan that feels natural and sustainable for you long term. You need support and encouragement both now and in the long term. And that's exactly what we do at DMP. And I know I'm emphasising this quite a bit, but that's because I know we've supported so many people before you to achieve optimal diabetes health. So if you want the right guidance and support to lower A1C, lose weight and stop medications, then take action and come and join us as a member. Go check out our programs and services at type2diabetestalk.com/programs. We've been doing this a very long time and our methods are scientifically proven to work. So you can trust you're in good hands and getting the right support to achieve the best diabetes health possible. In any case, I hope your understanding about diabetes remission has improved, and I really do appreciate you joining me today for episode 24. When it comes to achieving results, it's always great to hear about what's possible. And there's one key way to get the inspiration, and that is to hear other people's stories. And that's exactly what we'll be doing in next week's episode. hearing from several people about their outcomes, the lessons they learned, and their advice for others wanting to make a change. Be sure to tune in. Have a great week. Dr. Jeddah, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. U.S. Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.